Hi, my name's Emily Riggs, and I'm a therapist at the Kettering Health Behavioral Medical Center's Intensive Outpatient Program. In this video, we'll be addressing self-care, what it is, and how we can improve on what we're already doing. Self-care, it's become quite the buzzword these days, hasn't it? Social media is full of posts, images, and captions urging us to practice self-care. But what is it? From the images of bubble baths, massages, and manicures to putting on the green, laying in a hammock, or reading a book, we have an unclear definition of what self-care really is. Before we hastily label an activity as self-care, let's be sure we have the right idea to begin with. In the most basic definition, self-care means taking care of yourself. That's a pretty broad definition, which is probably why we've had such a hard time nailing down what is self-care. To help us understand this better, let's break self-care down into 5 different categories: physical self-care, psychological or emotional self-care, social self-care, spiritual self-care, and professional self-care. Let's start with physical self-care, which looks like meeting our basic needs. By this definition, if the activity works to improve or maintain our physical health and well-being, then it's likely a form of self-care. Here are some examples. Eating balanced, regular meals, hydrating with water, and no, the water in coffee doesn't count. Getting the recommended amount of sleep, engaging in intentional movement, and tending to our personal hygiene. Think things like showering, brushing your teeth, washing your face, applying deodorant, etc. Resting when you're sick, wearing clean and comfortable clothes that feel good on your body, taking your medication as prescribed, going to medical appointments as scheduled. Physical self-care also includes avoiding certain things, like mood-altering substances, think alcohol and drugs, smoking, using electronic devices within an hour before going to sleep. By this definition, if the activity works to improve or maintain our physical health and well-being, then it's likely a form of self-care. This seems pretty simple in theory, but for many of us, meeting this basic level of self-care is the first thing to go when we're stressed, overwhelmed, or our mental health is beginning to decline. A lack of these basic self-care practices is often an early warning sign, if you will, that we're not doing well, both physically and emotionally. Here are a couple more examples of physical self-care. Being in tune with physical symptoms of mental and physical illness. Understanding your physical boundaries and enforcing them appropriately. Understanding the limitations of your physical capacity. Creating space for routine rest and recuperation. Go ahead and make a note of how you feel like you're doing in this area of self-care. What are you doing well most days out of the week? What's an activity that could use some improvement or that you're struggling to complete on a regular basis? Let's keep those in mind while we jump to the next category. Psychological or emotional self-care are often lumped together due to a lot of overlap in the way that they address our mental needs. That said, for our purposes, we'll refer to it as emotional self-care. This category of self-care refers to the care of our minds. Examples of emotional self-care include expressing our feelings in effective ways, talking about problems we're facing, going to therapy, taking psychiatric medication as prescribed, learning new things, challenging our minds with engaging activities, think puzzles, word searches, or Sudoku, engaging in our hobbies, taking time off work, those mental health days, going on a vacation, or just getting out of town, reflecting on personal strengths and accomplishments, distancing yourself from common distractions like TV, cell phones, computers. Neglect of our emotional self-care is a slippery slope into other symptoms related to mental unhealth. When we stop going to therapy or taking psychiatric medication, for example, it's oftentimes because we feel better. But that actually might be a sign that those acts of self-care are serving their intended purpose. When we avoid or stop doing them altogether, we see symptoms of anxiety, depression, or other mental illnesses creep back in. In this way, we can see how self-care is often a preventative measure, one we can take to ensure we're setting ourselves up for success and to show up as our best possible selves. In this way, we can see how self-care is often a preventative measure, one we can take to ensure we're setting ourselves up for success and to show up as our best possible selves. Go ahead and make a note of how you feel like you're doing in this area of self-care. What areas are suffering from neglect recently? What's an area for improvement? Next up, we have social self-care, and that pertains to our emotional connections with others. Taking care of ourselves socially can look different for each person and largely depends on our personalities. Regardless of our personalities, though, everyone needs social interaction to feel connected to the world around them. I personally identify with an introverted personality, but that doesn't mean I'm antisocial. It means I just need smaller doses of social self-care to feel that like my bucket is filled up. Conversely, someone who identifies as an extrovert may require more social interactions to feel connected with those around them. Let's explore what social self-care can include. Spending time with safe and trusted people, both one-on-one and in a group setting. Connecting with friends and family who may live far away. Having connecting conversations. Connecting with others over shared interests and hobbies. Taking opportunities to meet new people and understand their worldview. Asking for help. Spending time connecting with a partner or a spouse. A neglect of social self-care can look like withdrawing slightly from those around you or complete isolation from day-to-day interactions. If we have social anxiety, for example, we may struggle to engage with others in social settings. However, this kind of connection is vital to our holistic care. Go ahead and make a note of how you feel like you're doing in this area of self-care. Who have you disconnected from recently? What would reconnection with safe and trusted people look like? Write down one practical next step you could take to make progress in this area. For example, I'll text my friend Katie to see how she's doing, or I'll email my mentor to meet up for coffee. Spiritual self-care is our next category. When we think about spirituality, a variety of images may come to mind. Things like prayer, church, reading a sacred text, or gathering with a congregation of people with similar beliefs. Interestingly enough, spiritual self-care is much broader than our religious affiliations and personal belief systems. At its core, spiritual self-care is about deep, soulful connection with oneself and one's beliefs and values. It can include many activities, but here's a list to get us started. Prayer, meditation, exploring what gives meaning to our lives, living according to our morals and values, taking time for thought and reflection, being a part of a cause that reflects your values, engaging with the arts, things like music, art, film, literature, spending time outdoors, attending a faith-based gathering. With this list in mind, spiritual self-care opens the door for us to explore who we are, what we believe, and how we want to live according to our values. This is important to create a grounded sense of self, allowing us to interact with the world around us with confidence. What are some spiritual practices you use to feel a deeper connection to self or to a higher power? Have you stepped away from these practices? What would it look like to include a couple spiritual activities into your routines? This could look like journaling, taking a walk, reading scripture, or volunteering with an organization that embodies your values. Be sure to write down a couple of activities that resonate with you. Next up, we have professional self-care, and that's our final category, and perhaps our most broad, as our concepts of work, careers, and personal lives vary so greatly from one another. Professional self-care is about working toward our personal ideas of success, reducing our risk of burnout, and ensuring our environments are supportive of our mental and physical well-being. This will look different for each of us, depending on our industries, duties and responsibilities, and our goals. Here are a few examples. Continuing education to learn new skills and knowledge. Advancing our education to gain a level of expertise. Taking on projects or responsibilities that interest you. Building relationships with coworkers and colleagues. Taking breaks throughout the workday, including eating meals and time away from work-related stimuli. Creating a workspace that is comfortable and brings you joy. Exploring opportunities for a raise. Advocating for yourself and others to have fair pay, benefits, and other self-care needs met. Creating boundaries between work life and home life. Professional self-care may be one of the most difficult to implement because we spend so much of our time in our working environments. It's worth taking time to reflect on how you're doing in this area and make changes to improve your self-care. Reflect on how you feel going to work and after coming home. Are there possible changes to make work more enjoyable and engaging? Discussing this with a trusted person may provide some insight in how to proceed. Our next step is making a self-care plan. Take a look at the notes you've taken for each category. Does one stand out over the others as needing improvement? Let's take this opportunity to create a plan for implementing self-care in at least one of those categories. That said, we've been speaking in general terms about these categories, so be sure to make this plan as specific to your life as possible. That's how change begins. So let's say you identified social self-care as needing some improvement. Perhaps due to anxiety or depression, you found yourself withdrawing from family and friends. What could it look like to take a step toward what you value in this area? What feels like a low-risk option for expanding social self-care? Meeting someone for coffee? Making a phone call? If that feels overwhelming, perhaps we start with a text message. After you finish this video, make a plan for each area, identifying at least one and no more than 3 practical steps you could take. Lastly, I want to talk about tips for sustainability in our self-care practices. Self-care is an ever-evolving practice related to our physical, mental, social, spiritual, and professional well-being. Much like the needs of our bodies change over time, so do the practices we implement for caring for those bodies. That said, in order to make these practices sustainable, it's important that we consider some of the following tips. Start to make your self-care a priority by setting boundaries. Make some goals related to self-care. Implement habits to help you reach those goals. Start small and keep it short, and then build from there. Even when you feel good, do not stop your self-care practices. Remember, self-care is about effective practices for your betterment. Ineffective activities like substance use, self-harm, and disordered eating are not self-care and should be discussed openly with your therapist and medical provider. Lastly, it's important that we touch on self-care during the holidays. No matter what time of year you're watching this video, you know that the holidays can be an even more stressful time on top of the usual stress we're experiencing for already busy and stressed out people. If you're walking into this holiday season feeling frayed at the edges, self-care could be the antidote. Ways to practice self-care during the holiday season include setting an intention for the season. How do you want to show up and remain present, as opposed to getting caught up and missing it? It looks like setting boundaries with relationship and time spent at gatherings. Creating space for a holiday season you would enjoy. Saying no. Following a budget. Making time for rest. Engaging in activities that bring us a sense of joy and fulfillment. Starting new traditions that are in line with your values. If after viewing this video about self-care, you continue to experience symptoms related to anxiety or depression, or even begin to have suicidal thoughts, please go to your nearest emergency room or call 911 for assistance. We look forward to seeing you in group. Keep practicing your skills. You got this.